Lucy Letby will spend the rest of her life in jail after she was convicted of the murder of 7 babies and trying to kill 6 more. Mr Justice Goss, who handed her the sentence, said she was in gross breach of the trust that all citizens place in those who work in the medical and caring professions. Alison Kelly, chief nurse at the Countess of Chester Hospital at the time Letby killed, has been suspended from her new job after being accused of ignoring concerns and apparently protecting Letby. Senior doctors had warned that Letby was the only staff member present during the sudden collapses and deaths of a number of premature babies on the neonatal unit. Now the Department of Health and Social Care has announced an independent inquiry, another inquiry, to look at the failings of the hospital in Chester. But what we're asking this morning, has this damaged your faith in the NHS? Cristo, we know that 4 senior doctors gave the alarm about their concerns about Lucy Letby's connection when these babies were dying. They were literally told to shut up and in the end had to apologise to Lucy for even implying she was doing anything wrong. Now, has it affected how you feel about the NHS in general, though, or is this just a one-off case?
It's affected how I feel about managers rather than the NHS as a whole, because clearly frontline NHS staff, the doctors, as you've alluded to, people who were on that front line, were almost waving neon signs saying something is up here. We need to look into what is happening here. And you are quite right. It wasn't actually until I think 2 years after the alarm was first raised that the police were even called. Managers, and I don't know why this is. I don't know whether it's backside saving. I don't know whether it is perhaps a symptom of our touchy-feely approach in society, that we seem to have managers nowadays that don't want to ask difficult questions, don't want to be annoying, don't want to scrutinise in the way in which they should. But it was an internal inquiry which sort of didn't really go anywhere. You're quite right. Managers told the doctors involved, this is an end to it, you can't talk about this anymore. Then there was this farcical apology situation. This all came from managers. Now, we've heard many, many times about the overwhelming number of NHS managers that are in the system and that there are too many of them and it's the frontline staff that suffer. This couldn't be more of a pertinent example of that. Those managers have blood on their hands. And I'll say it's not just the NHS where we need to be looking at this. It's social services. There have been a litany of cases. OK, we've got Arthur Labinjo Hughes. Do you remember that poor boy that was abused? Insufficient management, oversight and scrutiny. And that was the Ofsted analysis of Solihull Council. Star Hobson, where the family members, again, almost the same, neon signs. There is something going on here. And Bradford Council, that it was deemed unclear management oversight. Baby P, one of the most horrific and heinous and famous cases of this. Haringey, the manager failed to provide enough supervision to the social worker. So these are managers that are failing the frontline staff. Now, that doesn't mean that all frontline staff are always innocent in these cases, but certainly in this Letby case, it's the managers that I feel I have no more faith in.
Shazia, do you think in this particular incident, the hospital were more concerned with protecting the reputation of that hospital than protecting the babies in their neonatal unit?
Yeah, I mean, there is a stigma attached to whistleblowers. There is. And I think that what the managers did, who have way too much power to the point at which they override the decisions of the medical staff. I mean, who knows best in the NHS? Is it the managers or is it the doctors? But they have so much power. They've said, you know, what matters more is what we say, not what the doctors say. And there is a stigma attached to whistleblowers whereby, you know, if somebody makes a complaint, somebody, you know, raises a concern, they were shut down. And the more you shut down staff, eventually those staff will stop speaking. And that's what they did here. to the detriment, obviously, to what happened.
Yeah, and there was a parent, also a headline from today's Times. Lucy Letby Hospital rejected parents call. There was one mum who was very concerned about Lucy, and the hospital didn't take any notice of what she was saying as well. Right, okay. Now, even more interestingly, the actual CEO of this hospital was a paediatrician himself, so he was actually a qualified doctor as well, which makes it even more appalling. Now, we're going to bring in now someone who works for the NHS to see what they think of this. NHS GP Dr. Natalie Rout in London. Natalie, thank you so much for joining us this morning. Natalie, firstly, this is, I think, probably the most horrific story any of us can actually remember involving the NHS, although, as Cristo has pointed out, there have been plenty of other examples. What do you make of the way the hospital trust in this instance reacted to doctors giving red flags about Lucy Letby's behaviour?
Well, it's appalling, isn't it? And I think the medical community is outraged that concerns were raised multiple times by senior doctors. These are very experienced clinicians, consultants, with sort of clear concerns that something was happening. And I think it's even more outrageous because for doctors, for example, if, for trivial things, we can be reported to the General Medical Council, the GMC, for investigation to make sure that we are acting in the best interests of patients always. And yet these managers and people in senior leadership roles that are involved in this case, they're not held accountable by anybody. So it really is shocking. And unfortunately, lives were lost. Like I said, trivial things can happen, and doctors and nurses are reported to their own councils. But here, lives were being lost, and yet these senior doctors' concerns were not heard. It's really, really tragic.
Natalie, as a doctor, I mean, seeing patients every day, how does it make you feel that maybe patients have lost trust in doctors and nurses now?
I wouldn't be surprised when, in a case like this, where so many families have been affected. It's impossible to imagine the suffering that they have experienced and will continue to experience for years and years to come from this one lady's actions. And so it's not surprising if people are worried about their babies going into a neonatal unit. I would feel the same way, but I think it's important for me to stress that this is one lady. There are many, many other doctors, other nurses, other healthcare professionals working the NHS that will do a good job, that have patients' best interests at heart. And you have to sort of trust in your professionals, because otherwise, where do you go? It's really sad. And I can see why some patients may be very, very triggered by what's happened.
And Natalie,
but
obviously,
I said, it's one case.
We have to reiterate that it was actually NHS doctors that raised the alarm in the first place. So we're not tarring everyone with the same brush. It's the trust in general that maybe some areas of the NHS are more interested in protecting their reputations than protecting their patients. And we have had cases before, haven't we? I mean, the Shrewsbury and Telford NHS Trust, Northwick Park, University of Hospital of Morecambe, all similar cases where, again, unfortunately, it was women and babies that were at the forefront of neglect and cover-ups, let's be honest, in many cases.
Yeah, you're right. And it's I think an inquiry needs to be held into why that is the case. Do we need extra supervision? I mean, we're all trained in safeguarding. It's a mandatory requirement. Every year we have to go through some of the cases that have been mentioned on the show already, like baby P. And we're reminded about things to look out for. But ultimately, in this case, this highlights the fact that concerns were raised and nothing came of them. So really, we need to be holding those in power, those in leadership roles accountable as well, so that we can prevent things like this from happening.
Natalie, thank you very much for joining us this morning. Appreciate your time. That's Dr. Natalie Rout there, who was joining us to talk about how we feel about the NHS now. Do we have any trust left in hospitals putting reputation before patients?